Hi, my name is Eric Kazanjian, and I'm a fourth-year medical student at the Quinnipiac University Frank Netter School of Medicine. In this video series, I'll be interviewing individuals who have been diagnosed with Alzheimer's, as well as their caregivers on what it's like to live with this disease and how their lives have changed because of it. The purpose of these videos is to give these individuals a platform to make their voices heard, to educate the public, and to reduce stigma surrounding Alzheimer's. I've also interviewed two healthcare professionals to get their unique perspectives on the challenges of caring for those living with this disease. And lastly, I've included some resources on the channel, which I hope may be helpful if you, a family member, or a friend has been diagnosed with Alzheimer's. Thanks for watching, and I hope you enjoy.
So I'm Donna Fedus. For the past 30 years, more than 30 years now, I've been a gerontologist educator. Currently also an adjunct professor at Quinnipiac. This semester, I'm teaching a class I created called Dementia Fundamentals, and that is a class for undergraduates, all learning about dementia for a full semester, which is really a wonderful opportunity. And when I'm not at Quinnipiac, I am the gerontologist and founder of an education company called Borrow My Glasses, and we're all about new perspectives in aging and caregiving. Basically, I'm an educator, so I educate and support people with Alzheimer's and other kinds of dementia, and I also teach health professionals who work with people, who support people with dementia, as well as family caregivers. So whenever I do a workshop or offer a workshop through Borrow My Glasses for professionals, we would have continuing education credits attached to that course. So nurses, social workers, care managers, counselors, and so on, people that need those credits to maintain their license can take this as a continuing ed workshop and get those credits. We do have people who don't need the credits taking them just for their own continued lifelong learning and education. So that's the professional side. We teach family caregivers as well, and people with dementia themselves as well. So one thing I should just make clear, so I am saying this, I'm a gerontologist, but I should make clear that I'm a non-clinical expert in aging. The medical doctor who specializes in aging is called a geriatrician, right? Pediatrician works with kids, geriatrician works with older adults as a medical doctor. I'm master's trained, so I'm a non-clinical expert in aging, and I'm a gerontologist. Just want to make that clear.
What would you say some of the challenges that healthcare workers or providers, even caregivers, go through when it comes to caring for individuals with dementia and more specifically Alzheimer's?
The challenges are many. One is the stigma. And we know that there's a lot of stigma that surrounds Alzheimer's and really all kinds of dementia. And healthcare providers are not immune to that stigma. You know, unfortunately, we have really a dearth of training. There are so few people that sign up for geriatrics work as healthcare professionals. So I believe the statistic is less than 1% of medical school students take electives in geriatrics. You know, very few nurses are trained to be geriatric specialists, and so on, social work, and really in every single profession. And so we have a lot of healthcare workers out there that know a lot, but they don't necessarily know about Alzheimer's and dementia. And they fall prey to some of that stigma and some of those stereotypes about all older adults, meaning they see someone who's forgetful and they say, oh, that's pretty standard for an older adult. So they don't take it as seriously as they might. Or they don't necessarily know when to refer to a specialist to get that training. So I think one of the big challenges is a lack of training and understanding kind of what they're seeing. I would say a lack of time is a major challenge. You know, I don't envy healthcare professionals who have a very short amount of time face-to-face with patients, and they need to do a lot within that time. So that's absolutely a big challenge. I would say that we don't have social norms yet in place to take care of people with Alzheimer's. And so it's not sort of an easy pathway or an easy trajectory. So when someone comes in and maybe even they go through that diagnostic process and they get the diagnosis, a lot of times clinicians will say, you know, put your affairs in order. You might want to join a support group. See you in 6 months or a year. So they don't have great easy access ways to send people into more supportive environments. And I don't mean a change in housing. I just mean places to learn about the illness and what they're facing. So More tools for clinicians would be wonderful, and sort of creating these norms so that we manage Alzheimer's like we do diabetes or something else that has sort of a more clear pathway of how to help people. As an educator, we're happy to be one of those resources at Borrow My Glasses. And there are others out there. I mean, the Alzheimer's Association is an amazing resource. I am a community educator for the Alzheimer's Association on a volunteer basis. They have their 24/7, like whenever you want, their helpline, which I'm sure you have folks from the Alzheimer's Association in this series, but it's 1-800-272-3900 is that helpline number. And they help people with Alzheimer's, but really any kind of dementia. You can call it any time of day or night. Right after the diagnosis, though, I feel like the Alzheimer's Association is a good place. It's sort of like there's a shock that people have and thinking, oh my goodness, Alzheimer's is the most feared disease by people 65 and older, and the second most feared disease just behind cancer for people of all ages. And so when you're delivering what people see as bad news, or hard news, I should say, there's a bit of a shock right there. So that's another challenge for clinicians, by the way. They might not be able to get much information across to someone who's in that state of shock after a recent diagnosis. So I think it's sort of settle a little bit and then start looking around and learning. And for sure, people want to learn about it. There are resources. Alzheimer's Association, Borrow My Glasses is one resource. We're a smaller organization, but we are one. Any number of support groups exist, and your physician can probably direct you to some of those, or the Alzheimer's Association can. The Area Agency on Aging is a good resource to help kind of understand what's available locally to you as an older person, if you're an older person with the illness, which most are. Different senior living communities and even home care agencies can point you to resources locally as well. And really just asking people, it's probably one of the best things you can do is just start talking about it. And you're probably going to be surprised at how many other people are dealing with Alzheimer's. People don't like to talk about it, but once you bring it up and show that you're comfortable with that, you'll probably find a whole network of resources available to you. For someone who's newly diagnosed, I would say take a few deep breaths. You might need to challenge your own thoughts about what this illness is going to be. As I said, people really are afraid of Alzheimer's, and the reality of living with a disease that lasts on average from 8 to 12 years, or as long as 20 years, is it's very rarely like flipping a switch. And so even for something like driving, the research will tell us that people don't stop driving until on average 3 years after an Alzheimer's diagnosis. So, I mean, there are cases where someone, you're talking about Alzheimer's for this series more than sort of vascular dementia. If someone has a major stroke and it very quickly can change their life, but especially Alzheimer's, it's a very gradual decline, right? And so nothing is going to change immediately. And I think that's a good thing because it gives people who are newly diagnosed a chance to just kind of settle, get used to what's happening, start looking around and understanding what their life can be like. So sometimes that's a wake-up call for people to say, hey, there's things on my bucket list I still want to do. I want to live with a little more intention than I've been living. And that's a really reasonable thing to do after any major diagnosis. And dementia, Alzheimer's is one like that. Talking to people and learning about the illness, I think, is critical when you're ready for that emotionally. And that might not be kind of the day after you get that diagnosis. So allowing yourself some space and time. Advanced care planning is critical. And that is obviously for people with an Alzheimer's diagnosis, but really for anyone. And so we think, oh, when you're very sick, when you're very old, you should think about, end of life planning. And it's not true. People of any age should really be thinking about advanced care planning. But if you've gotten to the point of getting a diagnosis of Alzheimer's and you haven't done it, that's a good time to do it. Or if you have one, that's a good time to review it. It's a real gift you can give to your family members to relieve them of the burden to have to make care decisions for you without information. And that often leads to a lot of guilt down the line. I don't know, did dad want this? He never talked about it. And then you're in a position to making substituting your judgment for theirs. Very, very hard. Advanced directives in this realm are usually kind of a living will, right? Which is writing down any specific treatments that you want or you don't want. And that can be as general as I want pain relief, or if there are specific things you have an opinion about, you can write those down. Or it's naming a healthcare representative. That's what it's called in Connecticut. It could be called a healthcare agent or proxy in another state. And that is where you name another person who can understand the whole situation you're facing at the time and make a decision on your behalf because you've had conversation with them about your wishes and they have a general sense of what you want. So great idea to name someone you trust and probably a backup person. That person can ask. If you have an idea about treatments, you can form a living will.
Can you speak to the challenges that these patients and their families go through?
Having a serious medical diagnosis of anything, right, but especially something like Alzheimer's, which does tend to scare people, is a major change to someone's life and to the lives of people that care about them. And so having that diagnosis or going through that disease process, let me say it that way, that's probably more relevant than actually the getting of the diagnosis. It calls a whole bunch of things into question in terms of how that person functions. When might they need some help, right? Who might be the person to help them? There might be some assumptions about that by that individual who has the diagnosis and by the whole family system. And it can be very, very hard, even when it's not contentious in a family. It can be really hard to sort through those things and make decisions as a group when maybe you've only had to make a decision about where to have Thanksgiving, or some kind of general thing, and people have opinions about that too. But sort of what I think should happen with this person that I care about might be very different from what my sister thinks should happen about this person, or my brother thinks about that person. And so I think that that's a challenge, group decision making, and sort of how do you help someone. And I usually advocate for the platinum rules. The platinum rule basically says, do unto others as they would have done kind of unto them, unto themselves. And so that's a little bit of a different starting point, right? But it's kind of understanding, how does this person want to be supported, the person with the diagnosis? And it's hard, families are not used to talking about that in general. That's a lot of words there, but what I think the bottom line to one of your questions is, one of the biggest challenges family dynamics. And as often as I see family dynamics at issue, I see emotional issues coming up. And so as much as the actual hands-on care task or decisions that have to be made about medical issues and services, even bigger often are the family dynamics and the emotional issues that accompany someone through Alzheimer's.
So dovetailing off of that, can you talk about what compassionate care looks like when it comes to caring for these patients?
I guess I would say, just to remember, so sometimes we see this acronym PWD, person with dementia, right? And so if you're looking at it like that, the first thing is person. The last thing is dementia, in that acronym. And I think that when we're talking about compassionate care, that's a really good place to start, to recognize that it's all about that person. So what person-centered strategies, that brings us back to the platinum rule, right? How do they want to be treated? Which kind of, if you know that and you have conversation about it and you have open dialogue within the family system and from the individual and family system to the medical care team, right? It gives you a better chance of providing compassionate care. So I think it's recognizing person first, person centered. Strategies are going to be the best. Open those dialogue channels and be talking all the time. I think that helps to provide compassionate care. I think challenging your stereotypes about Alzheimer's. I actually know several people who say Alzheimer's was a gift in my family. Now, that's not everyone. And I think if you could say to those people, would you prefer your person not to have Alzheimer's? They'd say, yeah, I prefer that. But given that they had it, they said, I was so surprised that there was any upside at all. But there were gifts in this disease for my person and my relationship with my person who had Alzheimer's disease. In terms of closure in the relationship, in terms of finally getting to forgive someone, getting to have those conversations and be with a person in the way that you wanted and really hadn't been able to do up until that point. It's not an uncommon story that if not a gift, people see positives and upsides in this illness. So I think to challenge your own negative expectations about it can help to provide compassionate care, to recognize it's very gradual, right? And so knowing that someone has Alzheimer's doesn't tell you that much about them. You need to know a lot more than just that. I actually had some guest speakers in my undergraduate class in Quinnipiac maybe a week ago. And the gentleman who has Alzheimer's was telling a story about moving into a new community that had a pool. It wasn't a senior living community, just a community that had a pool. And he started to tell people, he met a few people. He and his partner were there, and they were both trying to meet people, and it was going well. And then he told someone he had Alzheimer's disease. And he said that they could visibly see people move away from them and say, oh, he has Alzheimer's. We don't want to talk to him. He's the same person. He's tremendously funny. Yes, he has some challenges, but he also can give to his partner, to his family, to his community. It's not one thing. And so in terms of providing compassionate care, I would ask people to expand their understanding and their definition of what Alzheimer's is. So there are a whole range of interventions for family caregivers that exist, but a lot of times clinicians are unaware of them and family caregivers are unaware of them. So I think movement in terms of raising awareness around those treatments is a wonderful place to put some energy. The interventions are very much impacted by the developer, right? The person that set it up. So for instance, there's Laura Gitlin, who is an occupational therapist by training. And she has a whole number of interventions out there that relate to Alzheimer's disease and specifically what occupational therapists can do. So reach to, and there's sort of a whole list of things that she's developed over the years. She would be one person. There was a researcher named Mary Middleman who came up with something called the New York University Caregiver Intervention, NYUCI, is the acronym for it. And I believe it's still going. We could look that up, but she kept it funded for decades. And it was this really wonderful intervention, or it is this wonderful intervention where if you provide support and education to family caregivers, and they have a structured way of doing that, number of calls and what kinds of professionals can do it and so on, you can help support that person so they feel more confident about the care that they're giving, and they kind of know what to do when something happens with their person with Alzheimer's. And it results in a number of positive outcomes for that family caregiver: less depression, right? Feeling better about the care that they give, knowing what to expect. There's a whole range. But also it keeps their person out of, say, a nursing home for several more years. What I would love for the general public to understand about Alzheimer's and people with dementia is that they are people first. And that even though there are things that are scary about this illness, I don't want to kind of gloss over that. There's a lot more to it than just the scary things. And if your person has Alzheimer's disease, they have it, right? You're not going to change that. We don't know how to cure Alzheimer's disease as of today, but there's so much that we can do to support that person with Alzheimer's and their family caregivers. But not if we're in denial, not if we won't talk about it, not if we buy into that stigma, then we really can't help. And that leaves that person with Alzheimer's very isolated. And it's very hard for me to think about a person going through Alzheimer's in that kind of isolation emotionally. Just so tough. And it's very hard for their closest family caregivers to also be going through a separate process in isolation. It's like almost the saddest scenario out there. So what I would say to the general public is, let's talk about this. Alzheimer's is scary, and there's so much that we know about how to help educate and support people so they can get through it and manage it the best that they can. And that in the end, accompanying someone through a hard time in their life is something you can do if you're willing to do it. So I would say keep learning, keep talking. We have to keep more clinicians understanding this and kind of raise the bar about what is the normal pathway and the social norm through Alzheimer's disease. We have a long way to go. There's a lot of exciting work ahead, I believe.